You are listening to Little River Radio, the official podcast for Little River Physical Therapy. On this podcast, we'll explore topics related to health, wellness, and injury prevention. I'm your host, Roxanne Darby. Keep in mind that every body is unique, and therefore the best approach to health for you needs to be individualized to you. Work at your own pace and mind your own body. The advice shared in this podcast is general wellness information and should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you are seeking medical treatment or advice, please talk to your health provider and be sure to consult with your doctor before implementing any lifestyle changes. Today, we will talk about pain management. You'll hear some tips on the use of heat and ice in pain management and get step-by-step advice from your local physical therapist, Dr. Fisher, on what to do if you sprain your ankle. I'll also talk about some of my personal experiences with scoliosis and long-term back pain and how physical therapy has helped me. Let's get started. Heat and ice. It's recommended that you use ice for the first 24 to 72 hours after an injury, and then after that, switching over to heat. In the first couple days, it is good to use ice every 2 hours while awake. Ice is good at reducing inflammation and muscle pain and spasms. The skin the ice pack is placed on should be red and cold. If the skin starts to turn blue or is excessively numb, immediately take off the ice pack. You should only begin to use heat at least 2 days after the swelling subsides. Heat will deliver more blood to the affected area and soothe pain. However, if you apply it on a brand new injury, it can make the injury worse. Overall, thermotherapy, the use of heat, is used more for pain management, and cryotherapy, the use of cold, is used to have a protective effect on the healing tissue. A clinical trial study conducted on patients with lower back pain found that patients using thermotherapy and cryotherapy alongside pharmacological treatment reported substantially less pain than the patients who were only on pharmacological treatment. Ask your PT, heat and ice. Whether to use heat or ice can be determined by the type of injury. For an acute injury, such as a twisted ankle or bumped knee, or for sudden swelling, ice is best. An acute injury is an injury which happens suddenly and involves pain, swelling, and difficulty moving. Heat works better to relax the muscles for a longer term or a regular reoccurring injury, such as back pain. Ask your PT, what should I do if I sprain my ankle? Follow the acronym RICE: rest, ice, compression, elevation. The most important part of your healing time is the first 24 to 72 hours. Place the ice on for no more than 10 to 15 minutes at a time. In this initial period of time, you should be icing your ankle often, about 4 to 5 times a day. After this initial period of time, you can back off from the ice, but you still may have swelling, which means that you are still in the acute injury period. Compression involves using a wrap to alleviate the swelling, but make sure that you don't cut off the circulation. Elevation should involve putting your feet up. You may notice as you are healing, the ankle starts to swell more towards the end of the day or under the heat, but this is a normal part of the healing process. However, if something hasn't cleared up within 6 to 8 weeks, that becomes a chronic condition. Additionally, sometimes with a sprained ankle, you will need to go into urgent care, and if you are uncertain, you should go err on the side of seeking medical attention. Unfortunately, in many cases, patients don't see a PT until 8 weeks or longer after their initial injury, at which time they are already in the chronic phase or have developed negative movement patterns causing pain in other areas. One of the most common ways that an injury becomes chronic is by your body overcompensating in an attempt to avoid pain. I'm always an advocate of my patients scheduling a session with their PT if they feel they have tweaked something, even if it hasn't gotten to the point of being chronic, so that we can focus on preventative care together. And usually, if I'm able to see an acute injury early on, I'm able to deal with it much more quickly than a chronic condition. My personal experiences with scoliosis. I was 11 years old when my mom first noticed that one of my legs was longer than the other. I was sitting on the floor of my grandma's house with my feet in front of me, and I noticed that my mom was staring at me. "What? Straighten your legs. They are straight. No, I mean both of them," she said. I think I rolled my eyes. They were both straight. "I think one of your legs is longer than the other," she said. Then she suddenly grabbed my feet and pulled them. "Ow! Mom, stop it!" "Yep, one of them is definitely longer." A few weeks later, we sat in a specialist's office. There were diagrams on the wall of bizarrely twisted spines and hunchbacks. The skeletal ogres decorating the walls looked more like Halloween decorations than anything I would have expected to be compared to. When they took my x-ray, the doctor asked me if I was sitting up straight or if I was wiggling. The doctor glared at me judgmentally and spoke to me as if I was 5 years younger than my age. "Were you wiggling? Because if you were wiggling, the x-ray won't come out properly." "I wasn't wiggling." The doctor said, not making eye contact with me. After the x-ray, the doctor spoke to my mom as if I wasn't sitting right next to her, or as if I was too dumb to understand what she was saying. "There's this really great experimental new procedure," she said, her eyes sparkling with the eerie delight of someone who sees humans as entertaining machines. "We would shave off some of your daughter's bone and use a metal rod to hold it in place, and then her legs would be the same length. But we would have to do it fast, really fast, since she is almost at puberty, so she probably will get a growth spurt soon." Thankfully, my mom whisked me out of that house of horrors. As we left, she squeezed my shoulders and said, "We don't have to worry about all that, Roxy. You are really lucky because your mom is a PT, and I'm going to show you how to deal with your back all on your own without putting some crazy metal rod in your leg." I was very relieved. And she did show me how to manage it without any kind of invasive intervention. I have never been in constant pain, but I have often had flare-ups if I overstretched or overexerted my back in some way. Throughout high school, I had recurring flare-ups of back pain, and my mom would always manage to talk me through popping it back into place. She would put her hands on my lower back and find where the pain was, and then talk me through tightening and loosening the muscles. I didn't even know this till I started writing this article, but apparently even once I moved to college 3 hours away, she had in the back of her head that if I ever had really bad back pain, she would just drive down and help me out. But eventually I moved to Chicago for grad school, and now I live in England. My mom was so worried that if I ever had a flare-up, she wouldn't be able to help me because she couldn't put her hands on my back to find where the pain was. However, we figured out how she could help me with issues remotely, and I learned how to regularly manage my lower back pain without any medications or surgeries. If you want to consistently manage recurring pain issues, the most important part is to realize when you are in pain. I know this sounds silly because you're probably thinking, how could you possibly not realize you are in pain? And if you don't realize you are in pain, then it must not be that bad. However, I have found that it's very easy to mistake physical pain for emotional pain if you don't realize you are in pain. Many times I've been worried that something major was going wrong in my life because I suddenly felt sad, but then I felt completely better just a few minutes later after doing my back stretches because it was actually my back that was the problem and not my mind. When I'm having back pain, I lie on the floor with my feet flat on the floor and my knees bent so that I have unweighted all of the responsibility for my lower back. I also sometimes put my feet up on a chair at a 90-degree angle, which also works really well. The key is to be in touch with what you are feeling inside your body so you can know what to adjust. And by being more in touch with what is going on in my body, I'm able to describe exactly what the issue is to my mom over the phone without her needing to touch my back. However, regularly practicing preventative care is just as important as knowing how to deal with the actual flare-ups. As a part of the preventative care, I regularly stretch my lower back with the physical therapy stretches that my mom gave me. I find that child's pose is particularly good as a gentle stretch to regularly do. In child's pose, you sit on your knees and stretch your arms forward along the floor, which relieves pressure off your lower back. Another thing I do is I regularly use a heating pad on my lower back. Even when I'm not having a flare-up, it's just a regular practice I do as a part of self-care. I also tend to do this a lot during my period because I tend to have menstrual cramps in my lower back instead of in my stomach. Over time, using heat on my lower back has also become a sort of relaxation practice for my mind as well. Just like making myself a cup of tea, I find it relaxing to use a heating pad or take a hot bath. It helps my muscles relax and relieves tension in my mind as well as in my back. When I have really bad flare-ups, my mom has talked me through a relaxation exercise over the phone to relieve muscle tension, which I'll share with you now. Thank you for listening to Little River Radio. If you have questions, comments, or suggestions about this podcast, you can email us at thelittleriverpost@gmail.com. Otherwise, I'll see you next time.